Actress Hayden Panettiere is challenging people to talk more openly about postpartum depression. The Nashville star talked about her own experiences on Live with Kelly and Michael after she gave birth to her daughter Kaya last year, saying it's something that a lot of women experience. She also said that postpartum is often misunderstood by women and around people that are around them. Now, joining us live right now is Dr. Zhao from University Hospital's Case Medical Center. Dr. Zhao, thanks for joining us. Postpartum is a topic that many people shy away from. They don't want to talk about it because of the horrifying stories you hear. Some moms who just snap, but you heard the actress there point out that it's very common. How common is it?
So postpartum depression is extremely common, Ramona. It affects anywhere from 10 to 20% of the population, depending on how severe you define the depression. And I hear you talk about women snapping. I think that's actually a really common misconception that postpartum depression is going totally crazy. And like Hayden said, it's a wide spectrum. And when you're talking about snapping, quote unquote, you're probably talking about postpartum psychosis, which is a different disorder. Yeah,
it's good that you cited the difference, because some of my sisters, after giving birth, it was mild depression, but we hear more severe cases of people actually wanting to harm their children. So what you're saying is that's not postpartum depression.
That's not what it is for the vast majority of women. Only about 0.4% of women have that sort of snapping where they actually do something like, driving their children into a river. For the vast majority of women, it's actually a much milder and wider range of spectrum. It could be they're just feeling blues. It could be more severe than that, more like your typical depression. But it's important to know that there is a wide range, and women don't have to feel like just because they have postpartum depression, they're automatically labeled crazy.
And you said feeling blue. What are some of the biggest warning signs?
So it's normal for most women, actually, after delivery to feel a little bit anxious, a little bit OCD. We get worried when people are persistently feeling this way and it's not getting better. They're not feeling more confident and self-reassured as mothers. If you start going from I'm not sure what to do to general feelings of negativity about yourself, and then sort of other symptoms like not eating, not sleeping, we get more worried that this is actually depression.
And that's when you should seek help from a doctor.
Absolutely, because postpartum depression is very treatable, and you should go right away if you feel like you might have it.
All right, Dr. Zhao, thank you so much for sharing your insights with us today.
Thank you. It's a pleasure to be here, Ramona.
And, well, this is, okay, not quite the video we're